Hello, everyone, and welcome to RevMD Sex Bites with me, your host, Dr. Deborah Durst. And so my story is, again, I opened a wellness aesthetic business after working 25 years in the ER and just experiencing changes as I aged, and functional changes as well. And when I was doing that, I developed a whole nother field of medicine, sexual wellness, that just didn't exist. Tons of solutions for both men and women. And so now that's my passion, is giving men and women those solutions. And again, we're doing this podcast to hopefully get those solutions out to more people. So please follow, like, and share. And today we're going to do some talking about the oshot. And I have a guest with me today, B. Halsey. And she actually does some tantric sex coaching here in Knoxville. And so we basically hooked up because she had come into the office for changes that, again, women, feel with aging. And so that's how we met for the first time. And she can tell us her story. She doesn't need me to tell it. So welcome, B. If you want to just introduce yourself and tell them a little bit about you.
Yes, as Dr. Durst mentioned, my name is B. Halsey, and I am in the Knoxville area, and I do definitely promote and teach tantric sex coaching. However, that is just one element of sex. What I came about to Dr. Durst almost a year ago now, for those changes that she mentioned, both with aging, and then with aging comes also a little pesky problem of sex for us women. Mm-hmm. And I discovered the oshot through her, which is, I cannot tell you, a fantastic solution per se for any sex troubles you may have, especially us women. We tend to, for the most part, not all women reach orgasm as easily. And I think most of these ladies out there can either nod their head and agree that that is the case. But there is a solution out there, and it goes beyond anything I've ever experienced. It's a fantastic medical treatment that addresses that little concern that a lot of us women have in the bedroom. Mm-hmm. And I encourage anyone to go ahead and try it. I will let Dr. Durst tell you the medical part of it, and then I'll come back and explain to you what type of results I've had.
Yeah. Not only the results, but we'll talk through a little bit of the procedure just so she can tell you, what it's like, walk you through the steps. But again, B, so what are some of the changes just in general that as we hit, our 40s and 50s, that we might be feeling from a sexual function? Because you touched on a couple things like orgasmic strength, but also the fact that some women don't have even vaginal orgasms, and that's a very common problem, but just changes that you might have experienced, those subtle changes, decreased sensation. What were some of the things that you were experiencing prior to the oshot?
Definitely decrease in sensation. A lot of that starts happening now. I wouldn't say, I know from dealing with other women that I coach, there are issues with dryness. But then there's the decrease in sensation and not having that pleasure, even though there's foreplay involved. There's maybe lack of blood flow to that area. Mm-hmm. And the oshot will address those. Mm-hmm. Amazingly, I got to tell you, the effects are pretty instantaneous. I mean, Of course, not the day of the shot. Your body does need to recover, but it's not downtime. It's just more of nurturing your body. But it's amazing how to start feeling that area be receptive to touch and feel, and even on your own, it's a good remedy. That's all I can tell you. If you start feeling where you don't
start feeling it,
you start feeling some form of aliveness in that area again.
Yeah. Well, and I think the issue is that, look, as our hormones decline in childbirth, right? And you've had 2 children.
Yes.
And vaginal deliveries.
Absolutely.
Yeah. So even with the weight of pregnancy, that whole space in the anterior vaginal wall and support of the urethra is just not there like it used to be. And so when we're doing the oshot, the oshot, we're taking PRP and injecting, and we'll talk a little bit more about that, into that area to stimulate collagen, elastin, but not only that, to stimulate nerve growth and blood vessel growth. And so increased blood flow is lubrication. It's actually a function of blood flow. And so again, we've talked before, and we'll get off and on topic this entire time, because we've talked before about the fact that again, lubrication is blood flow, and what helps with blood flow is foreplay. And so not only women, I mean, women know that, but what don't men know about that part?
Men don't know that is like the pregame. We can use a sports analogy here. You know, a man is his bat is ready to hit, but a woman is not ready yet. She needs that foreplay she needs that touch, that central touch in those areas of the nerves. And again, that's where the oshot comes into play. If you're having, for various reasons, as you mentioned, hormonal changes because we're aging, or the effects of childbirth, the effects of also physical training, fitness and all that, things are just not the same in that area for a woman. The oshot will bring it back to some form of life. It's like a rejuvenating, natural form of doing it. There's more sensation. Those nerves are more activated. And then it makes foreplay a lot more enjoyable and a lot easier to prepare you for the final act of intimacy and sex when you have that oshot. That's kind of like a backup. It kind of brings you back to that time prior to when those changes weren't there.
And I agree with you. It's an amazing procedure to have done. And again, I've experienced it myself many times. But the issue is that instantaneous effect that you're talking about does happen with a lot of women. I hate to set that expectation up for all women because it's not always the case. Because when we're doing regenerative procedures like this, typically 3 weeks to 3 months is when we're going to see that regeneration. We're giving the body back what it needs, but then it needs to form those blood vessels and those nerve endings and collagen, elastin. But a lot of women, for whatever reason, that space between the anterior vaginal wall and the urethra seem to be a space that holds on to the PRP that we're injecting. And so they get almost instantaneous benefit from it, which is pretty amazing.
Correct. And I agree with you. It's not instantaneous for everyone, just like having an orgasm for women is not attainable for everyone. However, I must say that a lot of it starts with a state of mind. When I got my oshot, I was prepared and ready that I knew that it was going to do something to enhance and correct some type of problems I was having. So if I already prepared myself for that, it did happen for me, particularly instantaneously. There's some people, and some you don't get discouraged just because it's not instantaneous. What you need to learn from it is that it's something that depends on your body. It's not one size fit all, but it is geared to address that issue that we all women do share. And that is that we need more foreplay. We need that area to be dealt with medically and also in our intimate life.
I agree. I think that is a piece missing, and we're going to talk more on that too. So, but if we're talking about the oshot, just walking into the office, again, you're in for other reasons or you're in for hormones and we're talking, but when you're coming in for the actual procedure, just so you know, it's not scary and it's not painful. And I'll let B talk about that, but we're drawing blood and we're spinning it down. And that's the platelet-rich plasma part, which is platelets have growth factors in them. And so then we're re-injecting those growth factors into an area to get, again, growth of collagen, elastin, blood flow, blood vessels, and nerves. And we can re-inject PRP into many areas. We can do it into the face, into the scalp for hair growth, lots of different places. And if you think about it, if you cut your arm and you get skin that grows back, right? So if we have a cut on our arm, we have platelets that go and stop the bleeding. Those platelets have growth factors in them, and then you get arm tissue that grows back. You don't get scalp and hair, you get arm tissue. So you have stem cells intrinsic to an area, and your platelets the growth factors in them are going to communicate with stem cells in that area. So when we're re-injecting them into the clitoris or the G-spot, anterior vaginal wall, you're going to get stem cells inherent to that area that regrows tissue to that area that has been missing, or because of childbirth or hormonal decline, or you're right, physical activity, whatever the reason is. But it definitely is like inevitable that it's going to happen with age. Women experience different things than men do, but we re-inject the PRP and those growth factors back into an area The anterior vaginal wall is the G spot, and we're re-injecting it just past that to support the urethra, because urinary incontinence is another thing that we'll get with aging and childbirth. And you're jumping on the trampoline. Did you have any of that beforehand?
Oh, absolutely. So my incontinence wasn't probably as intense as others. Again, it varies, but it was to the point where, my goodness, I should live in a restroom. I couldn't even. And again, the oshot helped with that as well. It takes care of it. And, one thing, as you were explaining it, I want the audience to understand it is the missing link to that solution. It is the missing link. And the procedure, to speak a little bit on it, the fact that it's natural should let everybody know why this is so good. It's not a chemical that's being injected there. It's none of that. It's your own body. We are taking the plasma from your own body and putting it back in an area that needs, those nerves need that. And like you said, rebuild the collagen and all that. So in essence, we're repairing. And that repair is the missing link for a lot of those women that are out there, not only facing the incontinence, but also the lack of feeling like they once did.
Well, that's huge. And you're right. The missing link, that's a perfect term for it, because incontinence is treated with meds, maybe surgery. But again, as soon as you cut on something, it's not the same. And instead, these are regenerative procedures that help with incontinence. But there is absolutely nothing besides regenerative procedures that can help with increased sensation again in orgasmic strength. And again, I don't feel like women should go through half of their life once they hit menopause, not being able to feel that orgasm that they had when they were in their 20s or 30s. And there's no reason why you can't get that back.
That's true. Not only that, I want the audience to understand that there's also a group of women out there that maybe perhaps have had children and they still haven't had an orgasm. It's not too late. This is for everyone as well.
That, yeah.
It is not too late. If you've never had an orgasm, please give it a chance. Give the oshot a chance, because it may get you to a place that you have yet to experience. And there's no reason why age, lack of experience, childbearing, or any of that, when there is a treatment out there that's natural and it's meant to, we decided, regenerate, rejuvenate, bring back that sensation.
Yes.
Because for us women, including males as well, but it's all about the sensation. You've got to be able to feel. That's how women orgasm. The feeling along with the mind together will get you there. And this is a tool, the missing link, that can help you achieve that, whether or not you've had orgasms.
Well, and it's amazing because I don't think a lot of women want to talk. Again, I keep saying that, like, women don't want to talk about lack of orgasm. So we'll talk about hot flashes. We won't talk about the fact that we're having vaginal dryness in the perimenopause or definitely menopausal area or time frame. But we'll talk about hot flashes. And so if you have dryness and you have pain, you can't fake that. But decreased orgasmic strength is one thing, but up to 80% of women may not have vaginal orgasms. Now, I don't think that almost anyone's going to have fully a vaginal, but at least I hear this all the time, but up to 80% of women don't have vaginal orgasms. And that's a huge number, but women feel like they're abnormal and that, it's only them. But in fact, there's a lot of women. And so again, doing oshot's regenerative stuff gives you that chance. And again, I think sometimes we confuse it because there's two legs that come down from the clitoris, and the clitoris is strictly a sexual organ. And so, to have a clitoral orgasm, but you have two legs that come down on the side. So I think it's a combination of a clitoral and a vaginal orgasm anyhow, and not strictly just a vaginal, because they work together and they're so closely related. But that's the only chance to really get that deep orgasmic or vaginal orgasm, if you've never had it, is to try with like the lasers or the oshot. And again, it may take 1, 2, or 3 if they've never been there before, where if you just have decreased sensation, it may take 1, and then you're there.
Correct. It varies. And I agree with what you're saying. It's combined for a vaginal orgasm. I believe it has to be both those legs down and the clitoris. Now, there's a lot of women out there that have only had clitoral orgasms per se, and they would stand to benefit from an oshot to then put it all together and, like you said, have a complete, what I like to call a complete orgasm. And yes, people want to talk about every subject except this one, but you're cutting yourself short. Why not talk about it? Why not just not talk about it, learn about it, get a consultation, know what to do, and realize that there are things out there for you. It's not over.
No. Yeah. And women need to talk more openly about it. Men, when there starts to be functional changes, it's objective, it's seen, everybody knows it, right? Only women know it. If it's just decreased orgasmic strength and what happens with men and women is when women take longer, to have an orgasm with time because we have decreased sensation. So the things we'll talk about, just that arousal and increased lubrication and just, again, getting the woman ready. But they need longer, and men tend to have decreased erectile strength and they want to go faster because they're not sure how long it's going to last. So that's a huge mismatch. And so basically bringing the couple back together, not only just from services and medical standpoint, but, coaching with them. That's another aspect of it, like opening those conversations, knowing that it's a common problem for both men and women when they age. And again, we can correct it, not even just with services, but opening conversations and again, a little bit of coaching to help the woman and the man understand each other.
Correct, because they have to, you touched on something that's very true. They have to understand the challenges both face and how those challenges, if dealt with, and the only way, how do we deal with things? By addressing them, by talking about them. You're able to deal, here's on one end, the woman needs more time and preparation to be aroused, to have that sensation, to be ready. And the male may have now, they don't have the durability where they can't go for long. Well, how do you fix that? Well, we have to sit down and talk about it. And it's a combination of coaching and then also the medical tools that are out there. I think that's the perfect combination to get everybody back on track to having healthy sex, because sex is healthy. It's also anti-aging.
Yeah. Well, the more sex you have, the more hormones that you secrete, the better mental, wellness that you have. You actually have better sense of like self and self-image and sexuality and all of that. If you're actually having sex feel, desired. And again, I think that if a woman senses an issue with a man or a man senses an issue with a woman, they think it's them, right? They think they internalize, they see that as their problem because, but it's not. I mean, it's an inevitable change that men and women will have, and opening those conversations, and we'll open those in the office. And again, we're very comfortable having those so that both men and women realize that those are inevitable changes. Everyone's going through them. It's a little more objective for men, less objective for women, but we need to be able to say we're not having the orgasmic strength we used to, and we want that back, and to empower ourselves to get that back, right?
Correct. Because if we don't address it, it's like treating any other ailment. If you're not feeling well, you're going to want to get to the bottom of things. You're going to want solutions. You're going to want treatments rendered to you to address, let's say, a stomach bug, or you're not feeling well, you're not breathing right, anything. Treat this the same way. Sex health is sex health, and it's out there, and we have it, and it's available. And once we open the discussions for it, I think people are going to understand that it's normal. I can't stress enough what you said. It is inevitable. Ladies and gentlemen, it is happening to all of us. However, that doesn't mean that we're doomed. There is the missing link. We have treatments for it. It's a matter of getting comfortable and realizing that it's part of life. And we want to continue to have sex because it's healthy. So if we open up discussions, we can start treating it.
Part of the joy of life. Yes.
It's part of life.
Absolutely.
It's part of the journey.
So, it decreases stress, right? Stress reduction is a big thing with that. So what we do too is like the laser. So we can really do a lot to increase orgasmic strength in women.
Correct.
A lot. And again, I do feel like conversations, communication, and finding, a comprehensive solution, people, is definitely, or for couples or a person, is definitely part of it. But we have so many services we can do. And again, if somebody's had children and they have dryness or pain or incontinence or just decreased orgasmic strength, and you want that back, we can do it. And we'll pair the oshot frequently with vaginal rejuvenation with a laser. And so we have 2 lasers that do it, and Votiva's one of them. And that's the one you had done.
Yes.
Right? And so that one actually is a non-ablative, so it doesn't ablate the surface. So there isn't any downtime if you don't want it, but we're heating the vaginal canal. So we're heating the whole vaginal canal with that. And if you have incontinence, we can focus into the anterior vaginal wall, which is the G spot. And then you get increased collagen elastin. We can focus there. But it's tightening everything. So you can actually feel some tightening as you're having it done. Then we'll focus on the anterior vaginal wall, which is the G spot, the area of support for the urethra. But we can go on to the outside and tighten different areas on the outside if anybody's noticing that. I always encourage pictures before and after, just because when do we ever get a chance to actually look at that? And if they're seeing that, they feel the difference even with the first treatment, but now they can see a difference. So a lot of women won't want it. And I really encourage them, they never have to look at it if you don't want to, but most of them do. So like 2 or 3 down the road, they want to see it. But we go to the clitoris too, because the clitoris needs stimulation for collagen, elastin, and nerves and blood flow. And again, we have a different laser treatment that can do a clitoral treatment as well, bringing stem cells to the area and just increasing your orgasmic strength. And we pair those with the oshot. Usually we'll do 3 lasers in the oshot. The oshot, again, we're basically telling the entire vaginal canal and the clitoris, the whole area, that it's injured and to repair itself. And then we dump a bunch of growth factors in there with the oshot. So that in combination is amazing for results. And you had the laser too. You had Votiva.
Yes.
Tell us, was it painful at all?
No, not at all. So everybody needs to take a little breath and realize these procedures are not painful. They don't require any numbing or anything whatsoever. They're quite comfortable, to be frank with you. And I encourage women to also know their anatomy. Yeah, you got to look down there.
Yeah.
You've got to see. It's part of you. That's your temple. That's your area. You need to be familiar with it in order to also enhance your sex. And that's part of what I do with the coaching as well. Encourage people to know their anatomy so they know what they like. When the Votiva, then, it's not painful. It's very comfortable and it's amazing. Again, I used to feel like I needed to live in a bathroom. From the first treatment, because I'm extremely in tune with my body, I knew right away, instantly, this is different. In a good way. It was a lot better. It is fantastic. It gets a lot of, like she mentioned, the tightness, a lot of that things being put together where they maybe weren't put together. My particular focus was on that, on the incontinence and wanting to have a little more control of that. And it's done wonders. And I do believe that when you add the oshot to these treatments, it's like the cherry on top. It brings it all together and it just completely maximizes that area. And now you're ready. Again, everybody's different. Some require 1 or 2 oshots. That you never know. But the benefits are there regardless of how many treatments you may need. And because everyone's different, I do encourage everyone to give that a try as well. The Votiva has been fantastic.
Yeah, I love the Votiva treatment. Yeah, because you can focus in on the different areas. And again, the clitoris needs to be focused on with both the oshot and the Votiva treatments. And we can go to the outside. But yeah, you're right. Knowing the anatomy, I'm pretty surprised at the women that don't want to take the pre-pictures. And, again, a lot of times the nurses, are going to respect that. They're not a lot of times. They'll fully respect it. What they don't do that I do is direct and really encourage, because I know that 99% of the time at treatment 3, somebody's going to want to see it, because typically they start to feel the difference as you're doing the first treatment. And so, but they don't know that pre. And so if we don't have those pictures before, we can't compare them. And the ones that we didn't do befores with, they wish we would have. So they get to the 3rd treatment and they really wish that we would have taken pictures before. And again, these days, part of the medical record, right. Nobody's going to see them. You don't have to see them if you don't want to, but I'm with you. Women should know their anatomy. And that's an opportunity to open a conversation with the picture and get you more comfortable seeing it, talking about it, pointing things out, anything that might be bothering you. And, you find that women just don't want to, or don't frequently know the anatomy like they should.
And it also doesn't allow you to open up your doors with your partner. Like, for example, I'll openly share, when I did my Votiva, by the second one, I wanted to know. I knew what I felt. I can tell the differences. I'm well in tune with my body. I know my anatomy in and out. I want to. And again, you have to have a compare and contrast. I know they feel the difference, but there's something about a visual that makes a difference. But you also communicate with your partner. I remember by the second time, even my partner was like, oh, wow, yeah, this is different. It's a game changer for the good. And again, I can't stress enough how the fact is this is pain-free. Everybody should be motivated over the fact that this is very much no downtime, pain-free, comfortable, and
no drugs, no surgery,
nothing. It's all natural. If anybody can believe that, it's fantastic. It's easy to be skeptical, but I can tell you, I've had this and it's fantastic. It's done wonders.
And when we do the oshot, we'll do some topical, and then we do a clitoral block. And again, I have been doing them for years and train other physicians to do them. So it's not uncomfortable. Everybody's going to be apprehensive no matter what at first, just because we're putting a needle in their clitoris and the G-spot. And so it's hard to believe that we're going to do that and you're not going to have pain, but how relaxed they are after when they know it's all over and they had no discomfort whatsoever. So you just need to know, you just need to trust.
Yeah, just trust and take a chance and realize that it'll be well worth your while. And it is something, like you said, everybody's going to think, oh no, that's my sensitive area. It's my private area. Yeah. Yes, it is, but it's not painful. And the fact that it can be done in and out, it's fantastic.
Yes. Yeah.
And you just have to try to know.
I would not put women through it if I hadn't been through it myself. So again, the first time I heard about the oshot and p-shot, and I didn't know anything about them. So I needed that person to tell me all about these shots. What is that about? And so I was signed up for that training within months. And so went down to Fairhope, Alabama, and trained with Dr. Reynolds. And again, you have all of the treatments when you're there, all the vampire treatments, including the oshot, and phenomenal. Again, I've had 3 children, vaginal deliveries, probably not the incontinence that I would have thought either, but definitely if I was on the trampoline or really active, there was urinary leakage and, at very inopportune times and surprising times, you just had a full bladder and you're on the trampoline and didn't think to go to the bathroom beforehand.
Correct.
So just little things that were inconvenient for me. But then basically I had them and I was still thinking it's going to take months. I never had incontinence again for a year and a half. So, and that's individualized too. So somebody might, and at the time, that training wasn't with a laser and we didn't have laser in the office at the time. I started just with oshots. And so I didn't know if it was going to be right away or months down the road, but I never had incontinence again for a year and a half. And that's individualized. Some people might need 1, 2, or 3 oshots to get stress urinary incontinence better. Might need one, might need one every year, might need it a year and a half, who knows? But again, there's no limit to the oshots because it's all natural, as you point out, and it's not painful, but you can increase sensation each time, and it's cumulative. So if orgasmic strength is what you're trying for, and definitely for those women that haven't had what they term as a, purely vaginal orgasm, they can get that. I mean, I wouldn't say it's not a guarantee, but the only way you're going to get it is if you attempt with an oshot. And again, we can do stem and we can do other stuff that kind of, take that oshot to another level. But each time it's cumulative. Yes. And so every time you do it, you're going to get increased sensation, increased blood flow. And so your chances of orgasmic vaginal orgasms at some point is high.
Right.
It just depends on how many it's going to take you.
Well, I love that you brought that up about the cumulative, because that is something that I do want everybody to understand. So it's a win-win. You're not, by walking down this path, whether it's 1 or 2 or 3 down the line or once every year, and like you said, you are building up, you will eventually get what you're achieving. Your chances, your stakes are higher. You don't lose with this. Treatment whatsoever. There is no loss at all. If anything, you're setting yourself up for, I'll speak on a personal level. For me, I don't have necessarily a problem for orgasm, but I did realize prior to the oshot that not only the incontinence, but it was taking me longer to reach than it normally used to. And that was part, again, for the inevitable. I'm aging, the childbearing, all those things came into play.
Just the changes in that area.
Correct. Yeah. And I'm back to my usual self.
Yes,
it doesn't take nearly as long. And I'm excited, and I'm going to clearly say it. I will be one that will be doing this from this point forward, because why not? The treatment's there. It's only going to help me. It's not going to ever not. It can only make my life and my sexual health better.
Yep, absolutely. And you want that. And again, you bring up a key point, because if it's more insidious, the decline in sensation, then it's not like you just lose your orgasmic strength all of a sudden, or your orgasms all of a sudden, but it does take you longer. And for women, that's what happens. It takes them longer, and eventually it gets weaker, and eventually it'll go away.
Correct.
So preventing is the best first step, and so if you're just noticing subtle changes, that's when you really want to get on that, because especially if you've had children, so you can do, and I feel so strongly about the combination that unless if somebody's never had a child, or has vaginal pain due to maybe muscular contraction or vaginismus, then that's the only time I don't recommend them together. Otherwise, I really direct them to have both Votiva and an oshot together.
Right, because the oshot's like the cherry on top. You need it brings it all together. It's a great package. You can't lose with that. And it changes everything. And back to the uncomfortable of looking at your anatomy as a woman. You change down there, just like you change everywhere. It's an organ. And the Votiva addresses that as well, ladies. If there's things that you're noticing changes, if you do take the time to look, it will change that. It will make it better. All this is meant to be better. And I agree with you, it's preventive. If you're already noticing some of these things that are starting to diminish, treat it like you treat everything else. If your hair starts falling out, we run out and we want to buy the latest shampoo or any type of treatment to prevent that hair loss, correct? Yeah. This is the same. You start noticing, like I did, okay, my orgasms are taking longer to get there. Address it. Prevention is key.
We notice a little wrinkle under our eyes.
We run.
Or we notice something, or a little redness, or, I mean, we're on it, right?
We're on it. Same thing. Treat this the same way.
Yeah.
This is very important. I cannot stress enough how important sex is for your well-being, for your overall well-being. And I can understand we've come a long way. We've got tons of things now. We just discussed something that's fantastic. The package of the Votiva and the oshot together is a great combination.
We actually can put PRP under the nipples for increased nipple sensitivity.
Ooh, that's important too.
And we can also do...
there's nipple orgasms. So that's important.
Yeah. Because so actually I offer it up to my men too, just so you know. Most of the time, by the time I even get like the word nipple out, I've already heard a hard no. But still, I offer it up because, again, it's got sensation. That can be part of it. A lot of women,
that's
nipple
foreplay.
Stimulation is part of foreplay. It's part of orgasmic. Like they tie together. So it's so important. And it's amazing what the PRP underneath does. Then you can also do it on the sides, like the perineum or the labium majora. You can do what's called a wing lift if somebody did feel like they had some changes, like you say.
Correct.
We don't know what those changes are, but if you're looking, or your partner, or if you noticed anything, it just builds collagen, elastin, and tightens that up with the oshot too. So we take a little bit of PRP that's left, and then we inject it other places.
Again, ladies, do you hear that? All that is great. These are all tools that are at our disposal. Look at yourself, and if something is not what you want it to be,
you can change it.
You can change it.
And the fact that you don't have to have a surgery and you don't have to have medications. Now, having said that, again, even Cialis or a Viagra Cialis combination in low dose is great for women too. And you can use that because it increases that blood flow. And when you're doing it in a low dose, it also has anti-aging and anti-inflammatory benefits. So that's not a bad thing too to add. And again, I'm not a huge medicine person, but that's one of the times if you're increasing blood flow and you're doing it in a low dose with an anti-aging dose, anti-inflammatory. I'm a huge fan of anything that's like anti-aging, decreases inflammation in the body. We have peptides we can use for increased orgasmic strength. I don't think I actually told B, like, you should see her staring at me right now. Like, how come I don't know about this peptide thing? Yeah. She's about to hear it now.
I'm excited to hear it because you can sign me up.
I know. She's already given me the look like we haven't talked about. PT141 is another peptide that, again, almost everybody loves it, but when are they going to love it? Because they'll get some nausea with it. But it increases orgasms and orgasmic strength. Phenomenal for a different way to increase orgasmic strength. It's an injectable that you use. So you can get some nausea with it, but you acclimate to it. So, you know, when is it going to work and when is my nausea going to go away? Are the two big questions, but other than that, people love it. So yeah, she's already looking at
that's
me.
Another fantastic option. Yeah. Again, all these things are great to know that there are things out there that can resolve any hurdles that one can come across as we age in this journey, and realize that sex is not something that you put a pause button on just because we have these little hurdles. There's ways to address them. And
There's
again, some of them, there is a place for medicine there, for prescription, a small place for certain cases. But I can guarantee, at least I can say this with confidence, if you give the Votiva or the oshot a chance, you might be pleasantly surprised.
Yes.
You might find yourself that you may not need to go down that road. Not that there's anything wrong. It all depends case by case. The point being is these options are great that they're available now, and that we should be talking about this more and exposing it more, and let people come forth and share their experience like I am, openly and saying, I encourage everyone to give this a chance. And
I want to hear about everyone's experience too. So I encourage you to leave comments in the comment section.
Or questions.
Yeah, questions, anything you want to hear more about. So those are different options too that, you know, again, just increase your enjoyment for sex and having those conversations. Again, how to, just touching briefly. So say, you know, we're doing vaginal rejuvenation. We're doing, you know, regeneration in that area, rejuvenation, whichever, that's more of a local treatment, but hormone optimization is another thing.
Oh, fantastic.
You know, you've got to have, like, if you're perimenopause or menopause, and you need testosterone and you're not on it, you need to get on it. Yeah, you need that for sure, because that's a huge part of its drive.
Wonderful. It is amazing. And everybody has this misconception. Oh, testosterone is for men. Let me break it to you. We all have that. Yeah. It is a hormone that's part of a woman, and it starts to decline. And without it, as the doctor nurse mentioned, you do start to have that low drive. And with the low drive, it's like a domino effect. Then you start having other problems, and it just compounds your whole sex life. And there's no reason to. I've been on testosterone, and I've been the happiest person.
Optimized. Yes, because again, we will dose it differently, and we'll dose it to a different level
based on your need
and based on the patient's needs. But that drive, it actually helps with orgasmic strength as well. And then again, so
the vigor.
B is a perfect example. Women have the misconception that women are going to look like men when you have testosterone. No, B does not look like a man. No. So as you can see, she's on testosterone and as feminine as can be. So, so just know that that's not the case whatsoever.
No, it's not the case at all.
And I think they have this idea that that's going to happen. In fact, you're going to feel more sensual, more desirable, you know, more joy, more drive, more vigor in life. And so everything.
Yes. Your vigor increases, and it's necessary. Once you start declining, you want to I feel absolutely great. And I tell you, I want everybody to know that I am on the treatment, and I feel fantastic. I don't even want to think of being without it. Once you start realizing, it's like a redo. Without the lack of wisdom that you have when you're young. It's a fantastic way of life. And I want everybody to know that it's a way of life, and you should really consider that.
That's a good way to put it. So it's a redo now with wisdom. Yes, I love that, because again, you know, we get into, you know, we're in our 20s, we're just, you know,
figuring it out,
getting started. 30s, you know, we're still figuring it out. In the 40s, women really start to embrace their sexuality.
Yes.
And are not afraid to voice it, experience it.
We want these to open that discussion. Yeah. I think when we're having these conversations, it's meant to open those discussions for people to come out of their shell and realize, wait a minute, so that's what's been happening to me. Well, there's a solution. And come forth and deal with it, because you won't regret it.
No.
You won't regret it. I feel amazing from head to toe, and it just keeps on getting better.
And you look fabulous.
Oh, thank you.
And not one ounce masculine at all.
Not at all. That's a very big myth that people need to overcome. There is no reason to ever think that, because it's monitored and it depends on the person. I'm getting a dose that's what my particular body needs. It's very customized, and Dr. Durst does a great job at that, and she knows that. And
we'll
very
monitor,
pleased person.
Yes, yeah. Oh yeah, no, we monitor. We want women feeling fabulous. We don't want them to worry about. And again, let us worry. Let me worry about, those little things. There's so many corrections and tweaking we can do if you had issues.
Correct.
Just with a conversation. But we're in touch, and we want to get to know our patients. Our patients, will get to know us really well as well. And that's what we want. And so I think even if we were to end this one, think about women. You have conversations with your clients that are coming to you.
Correct.
But when you're even out just listening to women, because we started doing a women's wellness series, kind of stopped it for COVID. We're going to restart that again. So that'll be a great opportunity for you to come in and again, just get women comfortable talking about all of it. And so what do you feel like women when you're out with friends? Because it happens to me all the time. And you're in a group of friends and they're, perimenopause, menopausal age. What are some of the big things that they complain about? Like just outside of the office, outside of your clients, just friends. What do you think is a big?
So I've recently had an outing as well with girlfriends, like you said, outside of the professional setting or the business setting, client relationship, just women together. Well, some of them were complaining the lack of drive. Here again, back to the hormones and testosterone. Their libido's low. They're not feeling their libido's. They're not feeling. Maybe they would want to have sex, but then they really don't have the energy, or it's a short-lived burst of, I want to, then I don't. And then again, the changes that we've discussed about. One of them is married, and she mentioned dryness, and it becomes painful, and now it's an uncomfortable moment for both her and her partner. The partner doesn't want to hurt her. She feels she can't satisfied, and it just becomes a very uncomfortable and stressful situation. Lack of sensation.
You can't fake pain.
No, you can't.
Women can fake a lot of things, and they will fake a lot of things. And our orgasms aren't as objective, so they will fake a lot of things. They can't fake pain.
You can't fake pain or discomfort, right? Yeah. Which is, again, if you're dry. Or another one had an interesting concept. She mentioned, well, I'm not dry yet. I'm not having those problems, but it takes a long time to get lubricated. So that means, again, the body is changing. It's headed towards that problem. And therefore, she said she enjoys the sex, but she has been having less orgasms. Again, what do all those scenarios say to me? They say to me, this is why we have what you offer. This is the perfect woman that could be my next door neighbor, my friend, my sister, my aunt, my own mother, anybody. This is what this is for. This is what this treatment's for. If you have any of those concerns, which you do, whether you voice them out to your girlfriends over margaritas or whether you keep them, you internalize it. Yeah. The problem's there in one form or the other.
I think that even B brought up earlier, and we've talked about this before, is briefly like a massage that might increase even lubrication. So again, we want to address things comprehensively. So we have the services for you. We can help you with the incontinence, help you get your orgasmic strength back. If your mind, 99% of sex for a woman is in their head.
Right.
And so you've got to be in touch with your body. You've got to be mentally prepped, ready for it, receptive to it. So, and men don't always get this, and we can do another segment, and I'm going to have them basically comment and tell us what they want to hear about. But what's the massage part that actually helps with lubrication for women?
I like to say, so there's vaginal massaging. Think of it as what you do for your partner. For the men, it's the same, but for a woman. And here's another thing where the oshot and those things helped me on a particular basis. So I know all about the vaginal massage. I teach it. Prior to the oshot, I was realizing the massage duration was longer. Again, because the sensation wasn't what it used to
That's
be.
what it used to be, yeah.
You add that in, I'm back to my game's back on. But women need to be open to those things and open to both the treatments that Dr. Durst has available and also the discussion and the techniques that coach you. It's like a package deal. You learn about yourself. You learn how to identify what you like and how to discuss it with your partner and how to know it for yourself.
Ask for what you want.
Exactly. But know what you want. If you don't even know what you want. And then you have, okay, so you know what you want. You know how to convey that to your partner. But again, you mentioned it's a mental stimulus. Women need to be mentally stimulated. You need to learn these things. And those are taught by discussion and getting comfortable with the topic. And then once you've got that also, you realize, wait a minute, I'm lacking sensation down there or I'm dry. Then we pair it with the treatments that I myself have had, that Dr. Durst had. Now we've got the full circle.
Yeah, I agree. It's a comprehensive approach. And, you know, again, women need comprehensive approaches to it. We want hormones to be optimized. We want to be vaginally revitalized,
mentally stimulated,
nipple stimulation, everything. So
it's your body.
Again, yeah. So you definitely share, comment on the video. We were meant just to talk about just the oshot and the laser rejuvenation today, but we want to talk more about, again, a tantric orgasmic massage, mental stimulation with, women and how we need that, and maybe help men understand that better, so that we're opening those communication avenues with men and women and couples. They can listen together. So if there's something you want to hear about, let us know. We're willing to deep dive anything into sexual wellness.
Yes, we are.
So comment, subscribe, and share with friends. And we're willing to talk about anything. So let us know what you want to hear and give us your experiences as well. So thank you so much for joining us today on RevMD Sex Bites.